Welcome. What is quarantine? How to ensure successful quarantine? Isolation and quarantine help protect the public by preventing exposure to people who have or may have a contagious disease. Isolation separates sick people with a contagious disease from people who are not sick. Quarantine separates and restricts the movement of people who were exposed to a contagious disease to see if they become sick. A quarantine is a restriction on the movement of people and goods, which is intended to prevent the spread of disease or pests. It is often used in connection to disease and illness, preventing the movement of those who may have been exposed to a communicable disease, but do not have a confirmed medical diagnosis. The term is often used synonymously with medical isolation, in which those confirmed to be infected with a communicable disease are isolated from the healthy population. The list of quarantinable diseases is contained in an executive order of the President and includes cholera, diphtheria, infectious tuberculosis, plague, smallpox, yellow fever, viral hemorrhagic fevers, and severe acute respiratory syndromes. Quarantine may be used interchangeably with cordon sanitaire, and although the terms are related, cordon sanitaire refers to the restriction of movement of people into or out of a defined geographic area, such as a community, in order to prevent an infection from spreading. The word quarantine comes from a 17th century Venetian variant of the Italian quarantagiorni, meaning 40 days. The period that all ships were required to be isolated before passengers and crew could go ashore during the Black Death plague epidemic. Quarantine can be applied to humans, but also to animals of various kinds, and both as part of border control as well as within a country. Modern history. Epidemics of yellow fever ravaged urban communities in North America throughout the late 18th and early 19th centuries. The best-known examples being the 1793 Philadelphia yellow fever epidemic and outbreaks in Georgia and Florida. Cholera and smallpox epidemics continued throughout the 19th century, and plague epidemics affected Honolulu and San Francisco from 1899 until 1901. State governments generally relied on the cordon sanitaire as a geographic quarantine measure to control the movement of people into and out of affected communities. During the 1918 influenza pandemic, some communities instituted protective sequestration to keep the infected from introducing influenza into healthy populations. In the 21st century, people suspected of carrying infectious diseases have been quarantined, as in the cases of Andrew Speaker and Casey Hickox. Moving infected patients to isolation wards and home-based self-quarantine of people potentially exposed was the main way the Western African Ebola virus epidemic was ended in 2016. Health experts criticized international travel restrictions imposed during the epidemic as ineffective due to difficulty of enforcement and counterproductive as they slowed down aid efforts. The People's Republic of China has employed mass quarantines, firstly of the city of Wuhan and subsequently of all of Hubei province, in the 2019-20 coronavirus outbreak. After a few weeks, the Italian government imposed lockdowns in all the country to stop the coronavirus outbreak. During the 2019-20 coronavirus pandemic, India quarantined itself from the world for a period of 1 month. The United Nations and the Syracuse Principles. Guidance on when and how human rights can be restricted to prevent the spread of infectious disease is found in the Syracuse Principles, a non-binding document developed by the Syracuse International Institute for Criminal Justice and Human Rights and adopted by the United Nations Economic and Social Council in 1984. The Syracuse Principles state that restrictions on human rights under the International Covenant on Civil and Political Rights must meet standards of legality, evidence-based necessity, proportionality, and gradualism, noting that public health can be used as grounds for limiting certain rights if the state needs to take measures aimed at preventing disease or injury or providing care for the sick and injured. Limitations on rights must be strictly necessary, meaning that they must respond to a pressing public or social need. Proportionately, pursue a legitimate aim. Be the least restrictive means required for achieving the purpose of the limitation. Be provided for and carried out in accordance with the law. Be neither arbitrary nor discriminatory. Only limit rights that are within the jurisdiction of the state seeking to impose the limitation. In addition, when quarantine is imposed, public health ethics specify that all restrictive actions must be well supported by data and scientific evidence. All information must be made available to the public. All actions must be explained clearly to those whose rights are restricted and to the public. All actions must be subject to regular review and reconsideration. Finally, the state is ethically obligated to offer certain guarantees. Infected people will not be threatened or abused. Basic needs such as food, water, medical care, and preventive care will be provided. Communication with loved ones and with caretakers will be permitted. Constraints on freedom will be applied equally, regardless of social considerations. Patients will be compensated fairly for economic and material losses, including salary. United States. In the United States, authority to quarantine people with infectious diseases is split between the state and federal governments. States have primary authority to quarantine people within their boundaries. Federal jurisdiction only applies to people moving across state or national borders, or people on federal property. Federal rules. Communicable diseases for which apprehension, detention, or conditional release of people are authorized must be specified in executive orders of the President. As of 2014, these include Executive Orders 13295, 13375, and 13674. The latest executive order specifies the following infectious diseases: cholera, diphtheria, infectious tuberculosis, plague, smallpox, yellow fever, viral hemorrhagic fevers, severe acute respiratory syndromes, and influenza from a novel or reemergent source. The Department of Health and Human Services is responsible for quarantine decisions, specifically the Centers for Disease Control and Prevention's Division of Global Migration and Quarantine. As of March 21, 2017, Centers for Disease Control and Prevention regulations specified all commercial passenger flights must report deaths or illnesses to the CDC. Individuals must apply for a travel permit if they are under a federal quarantine, isolation, or conditional release order. When an individual who is moving between U.S. states is reasonably believed to be infected with a quarantinable communicable disease in a qualifying stage, the CDC may apprehend or examine that individual for potential infection. This includes new regulatory authority, permitting the CDC director to prohibit the importation of animals or products that pose a threat to public health. The rules do not authorize compulsory medical testing, vaccination, or medical treatment without prior informed consent. Require CDC to advise individuals subject to medical examinations that they will be conducted by an authorized health worker and with prior informed consent. Include strong due process protections for individuals subject to public health orders, including a right to counsel for indigent individuals. Limit to 72 hours the amount of time that an individual may be apprehended pending the issuance of a federal order for isolation, quarantine, or conditional release. U.S. quarantine facilities. The Division of Global Migration and Quarantine of the U.S. Center for Disease Control operates small quarantine facilities at a number of U.S. ports of entry. As of 2014, these included 1 land crossing and 19 international airports. Besides the port of entry where it is located, Each station is also responsible for quarantining potentially infected travelers entering through any ports of entry in its assigned region. These facilities are fairly small. Each one is operated by a few staff members and capable of accommodating 1 to 2 travelers for a short observation period. Cost estimates for setting up a temporary larger facility, capable of accommodating 100 to 200 travelers for several weeks, have been published by the Airport Cooperative Research Program in 2008 of the Transportation Research Board. U.S. quarantine of imported goods. The United States puts immediate quarantines on imported products if a contagious disease is identified and can be traced. Thank you for watching this video. Goodbye.